It's estimated that 20% of Canadians, that's 1 in 5, suffer from a mental health illness of some sort. In fact, some studies say that number could be higher. My name is Fin Donnelly. I'm the Member of Parliament for Port Moody Coquitlam and Morin-Belcarra. Historically, Riverview has provided mental health services in British Columbia for over a century. At one point, Riverview consisted of 1,000 acres. And at its point in the 50s, there were over 6,000 residents and staff at the Riverview lands. And it also has a world-class collection of trees, or arboretum, and heritage buildings. We know there is a lack of support for people with mental health issues and addictions. We just have to look at the downtown east side for evidence of that, or to the opioid crisis facing our country. We also know that Canada has an aging demographic, so diseases like Alzheimer's and dementia are on the rise. There's increasing incidence of PTSD with our veterans and first responders. There's increasing rates of stress and anxiety with our youth. And there's First Nations who face high suicide rates. And we know there are many other mental health issues needing our attention and research. The current vision for Riverview, which has been developed by the provincial government, wants to see some mental health on the site. They want to see some trees retained, but they also want to put market housing on the site as well as some economic uses for Riverview. The Premier has stated that these lands must be revenue neutral, which means whatever comes on these lands must create some form of revenue. This is according to the Premier, and this is after 100 years of taxpayers' money that have gone into providing mental health services at Riverview. What I'm very concerned about is the provincial government is going to put market housing on Riverview, which is contrary to what the city of Coquitlam wants, and loud and clear from what I've heard in the community, they do not want market housing. They want to see Riverview lands maintained in public ownership. So instead of market housing on Riverview, I'd like to see a national center for mental health excellence right here in British Columbia, right here on the Riverview lands. Under this new vision, the Riverview lands could consist of the following elements. There would be a campus dedicated to mental health and well-being, which would focus on mental health and addictions. Of course, there would be the world-class arboretum and heritage buildings, which would provide community services, drop-in offices, and perhaps addiction and treatment centers. There would be a National Center for Mental Health Excellence, which would focus on seniors, youth, First Nations, veterans and professionals, just to name a few. For seniors, there could be a focus on dementia and Alzheimer's. For youth, stress, anxiety, and addictions. The same with First Nations, stress, anxiety, and addictions. And for veterans and professionals, our first responders, PTSD and counseling services. And there could even be a health services research park, which could include industry, government, and academic collaboration, and the potential for expansion to other research areas like medical services or IT is possible. There's even potential for a health services research park, which would be an industry, government, and academic collaboration. There's potential for expansion to other areas like medical services, IT, and many other things. And of course, there's potential for young entrepreneurs, business incubation, and SME or small medium enterprise support. So the provincial government could work with a number of partners, including the federal government for funding and resources, local and regional government, including the cities of Coquitlam, Vancouver, Metro Vancouver, Coquitlam First Nation and other nations, academia like UBC, SFU, Douglas College, BCIT, the health sector, so companies that are doing research, or public sector unions for training and research, and civil society, nonprofit organizations who are also doing good research. There are many partners who could be involved in a National Center for Mental Health Excellence. But it's going to be up to the people. It's going to be up to people like you.